automation versus manual disinfection. Best practice in ultrasound probe high-level disinfection is achieved by manual cleaning followed by an automated system. The efficacy of wipes is user dependent. It's easy to miss spots on a probe just using wipes. In addition, if the wipe dries out, it doesn't have adequate chemical disinfection. Use of wipes there is insufficient validation and reproducibility, which has been shown. And wiping workflow is the least preferred by actual users of ultrasound probes. Turning further to automation versus manual disinfection, again, the efficacy of wipes is user dependent. The correct application of disinfectant impregnated wipes is very user dependent, which leads to inconsistent results. It is difficult to achieve and verify compliance, to have all surfaces that have been in contact with liquid disinfectant. Not only do they have to be in contact, but they have to be in contact for the required time. Test strip may be required to determine concentration, but that's not practical in most uses. The contact time is always defined for the product, but in practice, it's often not adhered to because people really can't memorize the times in their head. Microbial efficacy may not be achieved and a stopwatch may be required to determine compliance, but this is often not practical. Furthermore, in the HSE guideline for decontamination of semi-critical ultrasound probes, the wipe system was the least preferred option and stated it should only be used as an interim measure prior to implementation of an automated decontamination process. Furthermore, let's go on continue to talking about automation versus manual disinfection. Disinfectant impregnated wipes do not provide the same quality assurance as automated devices. If you ask 20 people to wipe a probe, likely all 20 would do it differently. The Robert Koch Institute in Germany stated that disinfection with manual wipes cannot be validated on site, which is a requirement for the final disinfection step of semi-critical devices such as endocavity ultrasound probes. There is no guideline or standard to advise the requirements regarding how a manual wipe step process can be documented by an individual in a reproducible manner. Has disinfectant wipe been applied effectively to all probe surfaces? Has the correct level of mechanical force been applied to all probe surfaces? In addition, has the appropriate time, been documented? In a recent study, it was found that healthcare personnel preferred using an automated ultraviolet light system, UVC high-level disinfection, versus chlorine dioxide multi-step wipe system. According to ISO standard 17664-1, section 6.7.1.2 states, if an automated system can't be specified, a validated method of manual disinfection is possible. Ultrasound probe decontamination that is automated for both disinfection and traceability thus ensures strict compliance with the disinfection protocol. Let's turn now to time and efficiency. One colleague, a clinical research fellow in obstetrics and gynecology at Imperial College Hospital, London, study compared Germatec Cronus UVC high-level disinfection to chlorine dioxide multi-step wipe system. The study concluded 98% of healthcare professionals found the Cronus UVC high-level disinfection easy to use and the preferred system of choice. Further, Cronus is 60% faster than chlorine dioxide wipes in the time it takes to complete HLD processes, that is cycles, per patient. Therefore, Cronus saves a total of 55 minutes, 45 seconds, allowing 3 extra patients to be examined based on a 4-hour ultrasound list of 15 patients.